Now another cause of systolic murmur is the another cause of systolic murmur. Okay, that is the actually the ventricular septal defect. Ventricular septal defect, due to ventricular septal defect, also the systolic murmur is created. Gap in the wall separating the ventricle. Okay, there is a gap separating the wall. Hollow systole. It is also hollow systolic murmur at the lower left sternal border. Lower left sternal border. It is here. Okay, this is the septal defect, and due to septal defect, the systolic murmur also be here. Now the second thing is diastolic murmur. Diastolic murmur is actually have four causes. Okay, it is due to aortic and pulmonary valve closes. Okay, first cause is the regurgitation. Okay, regurgitation. The second is the stenotic. Okay, so the four causes. One is the regurgitation. One is the one is the systole. One is the regurgitation. Another is the stenotic. Stenotic means narrow opening, and regurgitation backflow. Okay, so there are the backflow, aortic and pulmonary valve. Most blood leak right away, taper down over the time. For example, early diastole decrescendo murmur. Okay, early diastole, when diastole is started. Okay, so the decrescendo murmur mean that the murmur is the loudness of the murmur is increasing, decreasing. Okay, and the stenotic, if there is mitral or tricuspid stenotic, there is aortic and pulmonary valve regurgitation, and mitral or tricuspid valve stenosis. For example, opening snap in the mid of diastole. For example, when this is the diastole, the atria and the ventricle, the blood move from the atria into the ventricle. At the mid of the diastole, this atria contract, and here is a snap. During the mid of the systole, a snap is here. Okay, a snap, and this is called the this is actually the diastolic murmur. Okay, at the mid of the, and actually it is diastolic rumble, then diastolic rumble like this. Okay, the loudness of the sound is just like continuous, not decreasing or increasing. But it is also confused with Aston Flint murmur. Aston Flint murmur. What is Aston Flint murmur? For example, you have two things. This is ventricle, and above them, this is the atria. Okay, when the atria contract, and there is the mitral wall stenotic. Okay, mitral wall is narrow, so the stenotic the mid systolic click is here. Okay, and the Aston Flint murmur is when the aortic regurgitation is so severe, a jet of blood process from the a jet of blood process the mitral valve shunt. Okay, actually rumbling mid diastolic murmur. Mitral valve area are hard without opening snap, but you have to how to differentiate a stent flint murmur and the mitral tricuspid stenosis. First thing is the in the mitral stenotic there is the stenosis in the mitral or tricuspid valve, and due to the atria contract, and here is a mid systolic mid click is created. Okay, but in the Aston Flint murmur is actually from the aorta. Aorta have regurgitation problem, so the more blood come in during the after the contraction. Okay, so when the blood come, when the aortic valve closed but not completely closed, so the blood come here, and when the blood come here, it is so severe, a jet of blood passes to the through the mitral valve. For example, if more blood come out, so a jet of blood also go, they close this mitral valve. Okay, for example, the blood come from the aorta. This is again the atrium. This is ventricle. When the blood go from the aorta to the ventricle, and from the ventricle there is the mitral valve. Okay, and they just click this. When they just click this valve closes. Okay, so this also create a murmur. This is called Aston Flint murmur. Okay, so this is actually rumbling mid diastolic murmur, rumbling. Okay, mitral where area are hard. Okay, another thing is without opening snap. Here there is no opening snap. It just decrescendo murmur. First increasing the loudness, first increase the loudness, yes, and then decrease the loudness. Okay, so this is just Aston Flint murmur. Now the next thing is the continuous murmur. In continuous murmur here throughout the systole and distole, mean it is not just like start and end, start and end. It is just continuous in the systole and distole, both of the, in both cycle you have to hear this sound. Okay, most commonly is patent ductus arteriosus in the children, etc. There is a problem in the heart. Okay, in during birth, so that is also called continuous. For example, connection between pulmonary aorta and pulmonar. For example, this is the aorta. Okay, this is the aorta and there is the pulmonary trunk, and between the aorta and pulmonary trunk there is a connection, and this connection is actually closed during the birth. Okay, but if this not closes, what will be here? Here is the blood move from the aorta to the pulmonary trunk, and it create a murmur sound continuously. So this is called actually continuous murmur. Okay, now abnormal sound have, one is the S3 is the volume due to volume overload, S4 is due to pressure overload. Okay, and systolic murmur is actually, this is actually the summary. Okay, we have discussed the abnormal sound is S3, that is volume due to volume overload, S4 is due to pressure overload. Okay, and systolic murmur is actually due to stenosis, regurgitation, or hyper obstruction cardiomyopathy, if there is obstruction in the heart. Okay, another is the ventricular septal defect. These are the four causes of the systolic murmur. Okay, now the diastolic murmur is due to stenotic and regurgitation. Stenotic is the mitral valve, all are tricuspid valve. Regurgitation is due to aortic valve or pulmonary valve. Okay, another is the continuous murmur. Continuous murmur, so stenotic, there are two stenotic. One is the mitral or tricuspid valve, another is the aortic and pulmonary. This is if the stenosis occur in the mitral valve or tricuspid, it is actually diastolic murmur. If the stenotic occur in the aortic and pulmonary valve, it is actually systolic murmur. You have to understand this. If stenosis is present in the aorta or pulmonary, so it will be systolic murmur. If stenosis is present in the mitral valve or tricuspid, it will be diastolic murmur. Okay, and alternatively, if the mitral valve and tricuspid is stenotic, they create diastolic murmur, and aortic pulmonary regurgitation create diastolic murmur. Okay, and continuous murmur is heard throughout the systole and diastole, that is patent ductus arteriosus. So these all things are explained here. Okay, now we will tell about the blood pressure regulation. Okay,